speaking of up here, I do want to dive into a topic that you and I connected so much on the last time we spoke, which is the wise mind, because everything that we're talking about right now, the mindfulness practices, the power of presence, all create just a clear channel with God, source, the universe, whatever you want to call it,
Yep.
this divine force that's guiding all of us each and every day. What is the wise mind? Like, what's your perception of intuition?
Sure. I absolutely love it. I'm smiling because I love listening to you talk, because like I love how enthusiastic you are about this work, and like you get it from like a
Yeah.
different pathway, but it's all the same shit, like we're
Yeah.
all doing the same shit from a different pathway. So it brings me so much joy to like listen to you talk about it, because I'm like, yes, you get it. Like you get it,
Yeah.
and you can nerd out with me. So wise mind
Totally.
is this concept that it's a mindfulness concept where in any given moment we have two different parallel states of mind, and we can always utilize them to find our wise minds. In AA, we'd maybe call it the higher power, universe, God, whatever you want to call that. But it's really your intuition, right? So what we are always kind of leveling with is the emotional side of our mind, emotion mind, reasonable mind, and then we find wise mind by taking like the essence of each of those messages and combining them together. Not 50-50, and it doesn't necessarily mean it's going to feel good, but it's intuitively what is right. The thing that is going to move you forward, whatever that means. Like whether it be, not sending that text message when you're feeling lonely, because just sitting with that and calling a friend instead is actually going to help move you towards your goal of feeling more comfortable in your own self, right? So we need to ask ourselves, what is emotion mind saying to me, right? Is emotion mind saying to me, is it telling me to do something? Is it more impulsive? That's our emotion mind. Like it's generally more hot, it's more reactive. It's not really going to give a fuck, if you will, right? And then on the other side of that, we have reasonable mind, which tends to be more robotic and just more sort of like facts only, almost bordering on like judgment, almost like this is the right way, this is the wrong way. And the way that we make the decision is, the beauty of like, I think wise mind and DBT is it's not like you ever get to wise mind pinnacle. Like it's not like being in, the Garden of Eden. It's a decision by decision, like moment by moment, you can find wise mind. You can find what your wise mind is saying. And wise mind, like in and of itself, is always more than one option. There's never just one wise mind, right? There's different ways to honor the essence of what your emotion mind and your reasonable mind are saying to you to help you move forward in that moment intuitively.
100%. I feel like this is all resonating with me actually even more right now because I'm planning a wedding and it's fucking stressful. And I find myself in a highly emotional state far more often than usual.
Yeah,
How do you help people integrate this practice into their day-to-day life? Like,
sure.
I think, and I want to be careful not to over intellectualize things because I tend to do that. Like, I think
Same.
for me and for everyone, for a human being, it's so much easier to like live up here versus in here. But I think there's power in tracking these things
100%.
or, it's like a practice, right?
Yep.
You have to build that muscle.
Yep.
How do you help your clients integrate and connect more with their wise mind?
Sure. I mean, I think that part of what makes DBT so successful is that there is an individual therapy piece, and then there's the skills training piece, right? So then those two things are not together. I'm not teaching skills in my individual therapy. I'm helping people integrate what they're learning and figure out what's getting in the way of being able to like have a life worth living and live that life worth living through having the assistance of skills. But one of the beauties of DBT is that there is a concrete piece to it. And so like there is homework, right? I can ask somebody at any moment in time, do a Venn diagram of emotion mind, reasonable mind, and give me your tell me what wise mind would have been in that moment. We can walk through that because yes, it is making it a little bit more high level cognitive, and at the same time it allows people to kind of grasp it. And particularly if you are a highly sensitive person, which I happen to be, when you are super in your feelings, you have a much harder time thinking in a linear fashion, right? That's just science. And so being able to like pull out a piece of paper and make a Venn diagram is incredibly helpful. Like that's a grounding activity. You know what I mean?
100%. I have to know, what's your big three astrology? Do you know?
Wow, of course I know, and you're gonna laugh. You're gonna laugh. I'm a Capricorn sun, duh.
Okay, I see that.
And then I'm a Cancer moon and rising, and they're sister signs, which means I'm like extra, extra, if you will.
Yeah, I'm a Cancer sun. I am super sensitive and
Yes.
emotional, but I have a tough shell. Like I have a really tough shell, and sometimes it can be I can hold everything in though and compartmentalize everything. And so
Yep.
that's why actually that brings me to my next question on like your perspective on traditional therapy as well, because I feel like I did traditional therapy. Again, I haven't done CBT. I'm really interested in DBT. And I'm working right now with this company called Paradox Process, which is like a mantra based therapy, or they don't, it's
Love.
not a mantra based practice. They hate when I say therapy. But what's your perspective on just like traditional therapy actually exasperating wounds or like reopening wounds that don't necessarily need to be open? Like sometimes the door just needs to be shut and we need to move forward. We don't need to over intellectualize anymore. We don't need to we don't need to feel the feelings anymore. Like what's your perspective on that? Yeah, I guess in relationship to the work that you put out into the world.
Well, it's all a dialectic. I mean, the actual main goal of DBT is to be able to synthesize any two, like whatever it is that you're at a war with, and be able to feel the experience that you're feeling while not getting lost in it. And so, like when it comes to like insight oriented therapy, right? Like there's always a time and a place for insight. You know, it's not like in dialectical behavior therapy we exist in a world where we're only thinking about the here and now. Like that's
Mm-hmm.
impossible. And in order
Right.
to actually validate and understand someone's behavior and where someone's emotions are coming from, you need to have an understanding of where these things are learned, right? As a cognitive behaviorist, I believe they're learned. Like everything we experience is learned. But the issue with insight oriented therapy only is that particularly for certain like archetypes of people, right? Certain personalities, certain, symptom presentations, like it's just not enough. Like
Mm-hmm.
sometimes people need help knowing what to do next. And sometimes
Mm-hmm.
people need more instruction, especially as a sensitive person. Like we didn't learn emotion regulation the same way that like non-sensitive person did, right? And so
Mm-hmm.
when we were in kindergarten and watching Bambi the last week of school, and everyone cried when the mom died, and then you're the kid that's crying for the full hour after the movie, and the teacher comes over you and you're like, don't worry about it. That's not something that a highly sensitive person can do. And so, right, being able to identify for yourself, am I avoiding an emotion or am I behaving in a way to move myself forward? Is staying with this emotion actually harming me at this point? That's the flexibility that DBT gives you. And that's the beauty of having, like, I like to think of DBT as like an attachment oriented behavioral treatment, because it's so much of it has to do with the therapeutic relationship and what happens in the room and being direct and having feedback and collaboration. But it also, you have skills to help you actually figure out, like, I need to learn how to do this differently. Like staying in bed for a fourth month for me right now is not going to work, right? That's actually hurting me. And so even if my feelings are valid, I need to learn to act within my pain and not just like in pain all the time, so that I can live a more full life. So I don't feel like my emotions are driving the car and they're like an 18 wheeler. Does that make sense?
Makes sense. I mean, you have two things that you brought up, and we're like almost out of time, and I have so many questions I want to dive into. But I'm
We can
curious
be
if you
friends.
if you integrate always, if you do you integrate like attachment styles? Do you talk about that in your work? And then you mentioned like inner child essentially, which is like I feel like such a huge buzzword and kind of, trending right now, but it's so powerful. Do you integrate both of those into your work, and how do you work with them?
Sure. I mean, I tend to stay away, and you know this from my content. I tend to stay away from any sort of like isms, if you will, particularly when it comes to therapy, because I worry that, especially because of the way social media operates, that people will get attached to like the name and the identity and not actually understand it, and then gather all this information that's unhelpful. But yes, DBT is super attachment oriented. It's like a lot of reparenting, and it's a lot of inner child. Like it's a lot of understanding like why you feel so, why shame is such a huge determinant in like your behavior and in your life. Like where did that come from? Like
Right.
what is happening in your life right now that is reinforcing that? Right? How do we shift that
Mm.
around for you behaviorally so you can actually feel less shame when it is not warranted. That's reparenting yourself. And that's using the
Mm-hmm.
therapeutic relationship in order to understand your attachment style, right? Like it's using the therapeutic relationship, getting feedback, giving feedback, being able to have collaborative conversations, working through conflict. Working through conflict with your therapist is so important in DBT, like to the point that you can call your therapist outside of session and say, like, I need to talk. Do you have 10 minutes? Because there's something that you said in session that I'd really like to talk about, right? Like that's an opportunity to address an anxious attachment style, whereas normally an anxious attachment style would be people pleasing. They wouldn't bring that up. You're creating a space for the patient to learn to be able to address those things and essentially, again, reorganize their attachment style. So I'll say to people, that's more of an anxious attachment style, but it's not, it's more focused on like, what are you thinking? What are you feeling?
Yeah.
Does that make
Totally.
sense?
Yeah, 100%. I'm just thinking about like the gender silos that we created and how we're breaking through those and how that transcends to therapy. It's like where my mind is going.
Exactly.
Like we all just need to be like tuning into our fullest expression.
Exactly.